When I finish this box, it will be 5 months. And when I had my check-in last week...
Hey there, I'm Kim. I've lost 110 pounds on a GLP-1 medication. And I've actually been on them for over 2.5 years. That's right, OG! The people that decide if you're going to go up in dose is your provider. But here are some things that you should consider when you're having a conversation with them. If you're new here, I'm Kim, and I run the Plus Size Podcast, which is an award-winning podcast all about basically the disease of obesity and even type 2 diabetes, metabolic disorders, PCOS, etc. It's an award-winning podcast. It is in the top 1.5% of podcasts globally. Check it out. And I interview experts about the disease of obesity and these medications. Things to consider when you're thinking about going up in dose. You have to kind of move away some diet culture stuff when making this choice. Doctors expect you to lose between 1 and 2 pounds a week on average, and you are going to have weeks where you gain, and you are going to have weeks where you do nothing, and you are going to have weeks where you lose. It's just the way that it works. Weight loss is not linear. That is like diet culture myth, especially when you have the disease of obesity, because your body is always trying to fight you. Most people with obesity also have insulin resistance if they've had obesity for a long time. Our bodies were actually never designed to lose weight, so they always kind of panic when they do, but especially when you have obesity. Your body's always trying to survive the famine. This is just millions of years of evolution. It doesn't know there's no famine, which is why you're going to have times when you stall and why you're going to have times when you gain. And it's not a true stall, doctors say, until it's been 5 to 6 weeks with no movement at all. Definitely being on the lowest dose of a medication that is effective for you is the best practice. That's what the doctors say on the podcast. So consider, 1, what's your movement like? Like, what's your inflammation like? What is your rate of loss? It sounds like you're at that 1 to 2 pounds a week, which is excellent. How do you feel about the food noise in your head? Is it fairly controlled? How are you feeling about like the cravings that maybe you used to have that were a little more insatiable? Hunger is a good thing. It's a signal to nourish your body, so you definitely don't want to ignore that or not have that, okay? Although sometimes in the beginning, hunger kind of disappears completely, but usually over time, it'll return. We just don't want it to be all the time. We don't want you to be insatiable, right? And blood work. Have your doctor do some blood work. Check that A1C, see where things are. Most people, or a lot of people that have obesity are pre-diabetic. It's not all of them, but it is a good chunk, so you do want to check that blood work. Check those inflammation markers. Definitely consider how much you're able to eat and your side effects. Knowing all of those things, go in with your doctor or your provider and have a conversation of if it's time to move up. But the biggest answer to your question is there's no need to rush. If it's effective, ride it out. You're doing great. It's nice to meet you. Those of you who don't know me, please go follow the podcast.